Dr. Brian Monaisa is a plastic surgeon whose practice, Marang Aesthetics, focuses on breast rejuvenation, body contouring, pigment problems, Botox and fillers, as well as hand surgery. He joins me in studio. Thanks so much for your time on SABC News this afternoon.
Thank you so much for having me.
Let's talk about first the kind of person who goes for plastic surgery. It seems like a very elite thing where someone with lots of money goes to beautify themselves. Is that a correct assessment?
Actually not. Most of my clients are young women between the ages of 35 and 50 who have finished having their families and want to rejuvenate their bodies, get their bodies back. Maybe planning to go away with their friends, girl vacation, to Bali, want to be able to wear a bikini on the beach.
Okay.
So mostly mommy makeovers. I think those are my most happiest clients, most popular procedures and happiest clients.
Can you tell what's taking place in the economy in terms of the kind of people that are coming to your surgery and the amount of business that you have?
Definitely. The business of beauty is supposed to be quite recession-proof, but you do find that, when during tough economic times, people would be more interested in the non-surgical options and more the skincare, facial beautification, because, the capital outlay for surgery is a lot more than, for example, getting Botox or fillers, whereas what you're looking for is to feel good and to look good. So, it does vary with the economy.
So when it comes to that, talk to us about the kind of financing models perhaps that there are for people who want to get plastic surgery but cannot afford that capital outlay that you spoke about.
Okay. In general, people don't pay doctors after the fact, so you always have to receive your money first. And there's a couple of companies that do financing for that. They would finance it over maybe a 10-month period. There's a couple, quite easy to look up on Google. Fintech, I think, is one of them. So there's a couple of those. Most of my clients, though, prefer to save up and just, I think they enjoy it much more as a gift to themselves.
Yeah. Sure. So you've spoken about the kind of clientele that you have specifically when it comes to your practice, but of course you do keep track of what trends are around generally in plastic surgery. What are we seeing in South Africa specifically when it comes to the kind of surgery that people want?
I think about 80% of my practice is black people, so I think in that specific population group, plastic surgery as a whole is newer, and so we're catching up to the rest of the world. I think you're finding that people are coming in for Botox and fillers much more now than they were 5 years ago. And then in terms of general trends, I think the trend is slightly towards the non-surgical. People want smaller downtimes, people want more discreet interventions. So we do things like fat freezing. You find that instead of coming in for liposuction, someone would rather just come in for a 30-minute session of fat freezing.
What does that do?
We freeze the fat. We put a pad on whichever area you want the fat, and then the fat is frozen. And because it's frozen, the cells die, and then it's reabsorbed into the body. So non-surgical.
Wow.
I think a lot of people have a fear of general anesthesia, although I have to emphasize that we wouldn't operate on you if it wasn't safe,
Yeah.
Yeah.
Speaking of safety, Brand SA, one of the ways that they market South Africa is also, was at some point, this surgery tourism, where people from overseas, particularly England, come to South Africa, get something nipped and tucked, and then go on safari.
Yes, it's called surgical safari. It's quite popular, increasing in popular. I think South Africa is famous for its doctors. I think it's something we underestimate as one of our quality products. They kind of sort out all over the world. So people are finding that by flying here, they're taking advantage of the currency difference. You come in, you have the surgery, and you have a safari. Both two things that are unattainable to the average English person, Sure.
So I know you've spoken about the more aesthetically pleasing side of plastic surgery. That's not the only work that you've done before. There's so much more to plastic surgery than just caring about what your body looks like in a bikini.
Yes, definitely. I do a lot of pediatric surgery, so the cleft lip and palate. I do a lot of hand reconstruction. Actually, hand reconstruction is probably one of my favorite areas. You find kids born with congenital defects where, for example, they're unable to flex the elbow. We would reorganize their muscles by taking their lat muscle from the back and putting it where the biceps would be to allow them to flex their elbow and thus use their hand. Plastic surgery is quality of life surgery, so we tend to do whatever we can to help the person improve their quality of life. Yeah.
Back to the aesthetics then, what advice would you give to people when it comes to both the invasive and non-invasive treatments? Because there's still a lot of concern about what it's going to do to you maybe later on. We don't know the side effects of some of the things that people are using now, and also concern about what could go wrong.
Sure. So non-surgically, or in terms of skincare, I think, everyone always says sunscreen. So I'm going to give you a little bit better advice than that. I would say add retinol with a sunscreen. Add retinol to your regimen. It tends to delay and reverse the early wrinkling phase in your skin. I think most people who use retinol love it. And surgically, it's not about weight. I think that's the best advice I would give people. It's not about weight. It's about body contouring. So you shouldn't go to a plastic surgeon expecting miracles or expecting massive weight loss. What we do is help you, get the best look out of what you have. We can't necessarily take the weight away. And even if we did, if you didn't change your lifestyle, you'd find that you're unhappy in a couple of months, So, yeah, so get your lifestyle in order and then come see a plastic surgeon who can optimize what you have, help you with your confidence. I think that's the idea.
Thanks so much for your time on
Thank
On
you.
Point this afternoon. Dr. Brian Monaisa, a plastic surgeon, joining me in studio there.